Hey everybody, this is Doug Worsley again, your local realtor, and thanks for following me along with the journey. And as promised, I said I was going to do an interview with Dr. Brackney about the whole stem cell therapy. If you guys are anything like me, I actually like to know the person that I'm dealing with. So let me give you a little story. How I found Dr. Brackney was through a Facebook ad, and he was doing a seminar about stem cell therapy, stem cell slash PRP therapy. I went to the seminar. I felt real comfortable with them, and I did a little bit more research, and then that's how we kind of got connected. So, with that said, Dr. Brackney, welcome, and just give a little bit of background about how did you get involved with the whole regenerative therapy type process, and what's it all about?
Sure. So, my name is Dr. Michael Brackney. I'm a chiropractor and a wellness consultant. And I graduated in 1996 at Parker University out of Dallas, Texas. And I've been getting people well for a long time. And with a couple of core beliefs, I believe that the power that made your body can heal your body. I believe that if you give the body the right conditions, you're going to end up with good health. And so as one of the ways as a classically trained chiropractor, we look at kind of like 6 different areas that people can get help with. First they can have stress can cause health problems, and we help people manage stress. We have
There's a lot of that out there.
Oh, man. Yeah, a lot of hormone imbalances. Even with the blood sugar or men's hormones, women's hormones, a lot of different things. And there's some natural things that we can do. And I know my mom had a disaster when she went on hormone replacement therapy in there. We also know that deficiencies, and I don't know if you know this, but the American diet is not that great.
Yeah.
So people can have a chronic deficiency. And like in Michigan, I know we have sun now, if you're watching this in the summer, but 9 of the months, we're not getting any sun. So that means we're not getting any vitamin D. And if you don't have vitamin D, that's going to cause all kinds of health issues, from anxiety to depression, different things. So simply that alone. We also look at toxicities. There are certain things that people can take that actually make them feel worse. A lot of artificial sweeteners and MSG and different things can trigger health issues. So we started out with that. And of course, as a chiropractor, we know joint issues, joint pain, and we know nerve irritation can also cause problems. So Doug, that's kind of where I started this journey.
Okay.
And we were watching people get better, and I loved it. And that is still the foundation of our office.
Okay.
But what happened was Michigan changed the laws. Michigan's always behind in a lot of healthcare laws, and they now allowed collaboration between chiropractors and the medical community. Before, literally, a medical doctor and a chiropractor couldn't own the same practice.
Gotcha.
You could be hire one, but they couldn't be in it. But once that law changed, that opened up a whole nother world a couple years ago. And so how I got into this, Doug, was simply people are nutritional deficient. A couple of my friends in other states were doing IV therapy, like they were getting nutritional IV therapy, and they're going, wow, they're getting rid of chronic fatigue and depression and a lot of just health issues were coming up, their memory, their focus, their stamina. So I'm like, okay, well, how can I incorporate people? Because I've done oral nutrition for a long time, but you know what? Some people just don't digest their food well. Some people aren't very compliant in taking their vitamins. And some people just need that therapeutic level of, I need a super high dose to kind of boost me up.
Gotcha. Okay.
Yeah. So we started there. But once I realized you can do a nurse practitioner to do that, it opened up a whole other idea of how to help people.
Great.
And that's where
you got involved with the whole stem cell thing. So speaking of stem cell and PRP, give a little bit of an explanation. What is the stem cells and what is the PRP? Right. Exactly, because for the people that don't know what those are.
Right. So, when you take a look at knee issues in helping, and we don't do just knee, but knee's probably the biggest problem that most people have in joints. We can help hips, we can help shoulders, we can help hips, knees, ankles, a lot of different places. But knees really slow people's lifestyle down. So it's a quality of life issue, Doug.
Okay.
So when I started, I've been taking care of people, like I said, for 30 years, and I was seeing people that were getting knee replacements, and they had like a third of the time they would help them, a third of the time they wish they wouldn't have done it, and a third of the time it was a disaster. You look at, you could do the research, about 5% of the people that get a knee replacement have a mortality in the next year from infections, complications, all the different things there. So even though aligning the hips, getting good orthotics, getting good oral nutrition was helping, the next level to nutrition and alignment is actually stimulating the healing of the body. So the two things that we were talking about, I'm going to start with the PRP, is called platelet-rich plasma. And platelet-rich plasma is simply this. We know your body is designed to heal. When you and I went to school, we learned about platelets, and platelets stopped bleeding. You remember
Yep.
that?
Yep.
Probably one of the basic things. Well, science has come a long way, and they said, listen, these platelets not only stop the healing, but where you find platelets, they actually stimulate healing in that area, which would make sense, right? If you have a cut, the platelets clog the bleeding. Now you've got all these platelets. The body goes, oh, I better fix that area that's having damage. So PRP, which is short for platelet-rich plasma therapy, we actually can take your own blood or anyone's own blood. And that's why it's so safe, is because we're taking you to heal you. We spin it, it's spun down. Now, I don't do any of this. Of course, I have a nurse practitioner. She does all this. She pulls the blood, she spins it down, and it separates. Now it separates into 3 different layers. The first layer is your red blood cells. They're heavy. They have iron. They sink to the bottom. The next layer is your white blood cells, because again, cells are heavier. Now you've got all of the plasma, and the plasma is that clear stuff. So if you ever see yourself kind of after cut, you're leaking, and that clear stuff, that's plasma coming out, right? So you actually know you take that plasma level at the very bottom. Platelets are heavy. So in a little test tube, and we're only using like about 12 milliliters of blood at a joint. You can actually siphon out from the bottom the dense nutrition and the dense platelets. Now you transfer that into a knee capsule, or of course we've used it for elbows, we've used it for shoulders, chronic. You can use a lot of places. But when you inject it into that area, you take all the nutrition, you inject it into the area that needs to get healed, but it actually re-triggers healing, Doug. So this is what I'm going to say. Osteoarthritis means that you're breaking down faster than you're healing. For whatever reason, your joints have been wearing and wearing and wearing, and they're not recovering. And they've kind of got tired of recovering. And so when you take and you infuse it with nutrition and you infuse it with the platelets, it now stimulates a healing cascade. The body, it actually pulls in resources from your whole entire body to say, hey, this is like a brand new injury. Because if you broke your arm, you would have a brand new injury. The body would go, oh, tons of healing needs to happen here, right? You do the same thing in your joint. Now tons of healing is going to happen in this. Does that make sense?
Yeah, it does. So I guess kind of go off script here a little bit, but so like in my situation, I didn't really have bone on bone, but I was pretty close to bone on bone, or pretty there. So how does that help that? Because I don't have that cartilage there anymore.
So remember, when we take a look at the knee joint, it's a complicated joint. I've got some knee joints behind me, but you have your knee cap, you have the round there.
Yeah.
In those cells, think of it like a sponge. First thing a sponge does, it dries out, and then it gets rigid, and then it cracks and crumbles instead of flexing. Your cartilage kind of dries out and it starts to crack and crumble. And with the crumbles, when they break off, they wear away, they're not getting replaced. When we start adding the PRP to it, it actually lets those cracks start to seal back up and smooth back out. So PRP really helps with what's there. It really works. And when they say bone on bone, I will tell you that if it was true bone on bone, you wouldn't be able to walk or stand or anything, because 2 bones smacking together would just be horrible. You wouldn't bend at all. So, but you have very little to work with. But that's where we're actually able to take the next step, which is the stem cells. So stem cells are going to add material that you don't have in that area to reattach, to regrow, to divide, to help, again, fill in that cartilage space again.
Right.
So it's like adding sponge to that area, if you will.
Now, speaking of stem cells, this is just coming from the knowledge that I've been gaining a little bit. There's a couple different kinds, I guess. You can get it from yourself, or you can get it from an umbilical cord, in a sense, right? Can you explain the differences between that and why we go with one versus the other?
Yeah, so I will tell you a couple important things. Stem cell technology, like any other healthcare field, has made a boom in the last 5 years. You have stem cells, and you can get them from your bone marrow, you can get them from your fat, they can extract them from different ways. But your stem cells that they extract from you are not going to be as dense. They have to try and condense them down. It's usually pretty uncomfortable if they have to go drill into the bone, or they have to harvest them from fat, wherever different ways they have to do it. and they're the same age you are. So my average patient that's getting knee replacement, they're around 59. You got 59-year-old cells and you want them to do brand new things, start
Gotcha.
healing.
Right.
So it's easier on you to not have to have harvested from you. They're going to be a higher concentration, and they can control the concentrations and the quality. And they're going to be more active when they're in their, again, younger state. So the way that they're now harvested now, I'm very pro-life. I will not apologize. I think at one cell, a person's a person. You have all the intelligence to become a full person. But there's no but about that. These cells are actually a donation. So when a mom has a live birth, and it has to be a live birth, it has to be a cesarean section, you want very healthy cells. Cesarean because it's pulled at the umbilical cord, is pulled out very quickly. It's not jammed or stretched. That they can freeze it for themselves for later. They can discard it in the trash like they have for hundreds of years, or you can donate it. And so these are actually harvested from a brand new cells from an umbilical cord of a live birth baby.
So essentially, we're using cells that are coming from an umbilical cord, which is designed to create, per se, right? And that's the reason why it's more successful than
babies are just trying to grow. They just grow. And that's why we actually can get all the extra growth factors, because that umbilical cord is just rich with growth, because that's all a baby wants to do.
So one of the bigger questions would be then is, because a lot of times, like even in my situation, I went to a, orthopedic. He turned around and tells me I need to get knee surgery, replacement, both knees replacement, hip replacement, yada. Why is stem cells better than surgery / cortisone shots per se?
Well, that's a good question. No. Well, that's a good question. The answer is really simple. Most medicine for the knees. Now, don't get me wrong. Physical therapy can be good for the knees to strengthen them. There's some nutritional things you can, but most of the traditional medical therapies for the knees, like the cortisone shots, the Tylenol, the Motrin, the anti-inflammatories, all the painkillers are what they call palliative. And they're just trying to have you not feel your joint or not feel the pain until you get to the point where it has to be replaced.
So it's a cover-up.
It's a cover-up. Cortisone does not cause healing. And actually, cortisone has a long track history of being so toxic or risky. They usually only do 3 in any given joint is the recommendation, because more than that, it's going to cause risk, too much risk of, they call it joint collapse and different things. So the difference between trying to relieve pain and trying to promote healing is night and day. I mean, and I have a ton of great nurses. I take care of so many nurses, doctors and stuff, and they are just amazing people. But our healthcare system is pretty broken, and even if you look at if you get put on any pill by your doctor, you ask them when you're going to get off that pill. The answer is never, unless they switch it for a different kind of pill for the same problem they're taking for it. So, Doug, when I say, hey, I want to stimulate healing of that joint from chronic or acute injuries, the PRP has been around and it's studied, and both of these are studied at Harvard and Cleveland Clinic and all the big medical schools are studying it. We're using it on a very simplified basis. We're actually not doing anything besides taking. These are called adult mesenchymal stem cells. So they can't be just anything. They actually have in their division process, cells can be like an eye cell or a brain cell or a gut cell, but these are connective tissue cells. And so they can only be a connective tissue.
Okay.
So a lot of people have tried stem cells in the past, Doug, but the problem is this. In early on, they didn't exactly know what they were doing. They didn't exactly know, okay, well, that one might cause a tumor and that one, these aren't doing that. These cells have gone under 400 different tests for quality, for genetics, for disease, and screenings. You can't test them pretty much for anything else than they already have, because that's what they do.
Right. So, but essentially, though, what I heard from the very beginning of that conversation, and I'm going to go with what you told me before.
Yeah.
Which is essentially, if you got like a cortisone shot or something in that fashion, it's like you said, it's a masking, right? It's taking the pain away.
Correct.
But essentially then you're creating more damage because you don't feel the pain. and you're just continuously making that damage, getting it worse, getting it worse, getting it worse until you absolutely have to have surgery then.
Yeah.
That's essentially
That's
right.
100% correct. But the second layer to this, and this is very troubling, and the research studies have started to come out now, is that some of the NSAIDs, some of the things that you were taking the time for pain reduction are actually slowing inflammation, but inflammation, that swelling was keeping the joint from breaking down further. And they're finding people are actually taking the pain relievers are actually having farther and quicker damage than those that are not. So now, and they figured out the mechanism where it's blocking the healing, which again, when you take a Tylenol, it's trying to suppress something, suppressing your body's healing. And if you take it long enough, it then will start to reverse course on this. So now you're in a catch-22. If you don't want your knee to hurt, you don't want to be in pain, but also you don't want your knee to break down, you have to make your choice.
Right.
You know, a lot of people have to live.
Okay. So when you're looking at this process, I think I've kind of gone over in one of my other videos about my particular process of getting the stem cells PRP and then stem cell PRP type process.
Yeah.
Is that like the same for everybody? Are the processes different? I can kind of go over like what that process is and how the two interact with each other.
So the protocols that you see here have been generated over different years and different doctors and different things. You know, we have Dr. James Joseph. He's our osteopath in here, and he pays attention to those. And the company that offers stem cell has their expert panels, and they kind of guide what happens. Now, in my part of the journey, what I do is we can take an X-ray, and I can look at an X-ray, and I can decide, hey, what level of severity are you? You know, if it's mild, moderate, severe. And based on where you are, then there's a protocol that says, okay, well, if you're mild, we do A. If you're moderate, we do B. If you're severe, you do C. And if you're, extreme, then you can maybe talk about D.
Right.
So everyone's going to be a little different. Some people don't need stem cells. Some people just need platelet-rich plasma. Some people, we might just be doing oral nutrition. We talk about really high-quality collagen for joints and really high-quality glucosamine for joints. Collagen is hair, skin, nails, but actually you can get certain strands of collagen are actually more effective for joints and knees. So some may just need oral nutrition, some work, maybe some orthotics in their foot, maybe line their hips, and other people may actually, depending on where you are going to need all of it. They're going to need the oral, they're going to need the PRP, they're going to need the collagen. It's just kind of based on.
You just named me. I was going to say, I think I'm at the bottom of that list because I am doing the stem cell, I'm doing the PRP, I'm doing the collagen, and I'm doing the...
When people are when you're trying to avoid knee amputation, you really got to, and we look at the level of decay, and you've had history of banging your knees and hitting surgeries on your knees and stuff like that, you definitely are on the high end of that spectrum.
I knew that going in, but at the same time. So this process, I mean, how long till you feel a difference or you feel better does it usually take? Is it the full 6 months? Do you feel instant? Well,
I will.
Am I going to be mad after a month of coming in here and saying, "Hey, how come I don't feel any better?" You gave me one shot.
So there's 3 things to remember about this. Number one is people are coming in different severity. So if you had an acute sprained strain, you just tore it at the gym or whatever, you're going to recover faster. If it's chronic, it's going to be longer. And then we also looked at the gauge of severity of that. So we have to remember the longest people are going to take the longest to respond in general. Now, I can 100% tell you, most people, and you already told me, are already noticing positive changes, usually within a week or two of the first shot. Changes. That doesn't mean they're better.
Right.
Because like I said in the beginning, it takes about 6 months to fully experience that. But that's why we actually, in the protocols, they layer in more healing nutrition into the knees with more PRP, and they repeat that. And we've got results where other people haven't, because we're not just. I've talked to other people that have had great success with PRP, and I've talked to some of the ones that didn't have good success. I'm like, what'd they do? They gave me one shot, and my knee's still sore. I'm like, well, did they do nutrition with that? Did they do, what all was done with that? And they're like, no, that was one and done. I'm like, well. I will tell you that, we use 5 million stem cells per knee, and they oftentimes don't even know how much they had. How much did you have? Did you have 1 million? Did you have 2 million? So if you're not using the right quantity, the right quality, the right type, the right timing, if it's not preserved properly, there's a lot of, our nurse practitioner is amazing. She's really good with her injections. And there's a lot of different factors involved, but to answer your question is, yeah, people feel usually good within the first couple months, are feeling, significantly better. And usually by about month 4 or 5, they're going.
But I think the key there though is that you have to follow the process or whatever it is. So for instance, in my particular case, we did the first one with stem cell. Earlier today, we did the PRP, but in the meantime, I still got to make sure I'm doing the collagen and the, what was the other one I'm taking? Glucosamine, yes.
And not sulfate. These are both powder, and they're both actually highly bioavailable.
Yeah, and because I did a video on those as well, because I put them in my water. There is a slight taste, but not much.
The collagen has a little bit of taste.
But, if you mix it with juice or coffee or something like that, it's usually pretty good. But I'm very adamant about making sure that I follow processes, because I can't give you 100% or a 0 if I don't follow the process to the T. So I'm doing exactly what I'm supposed to be doing because I want to make sure that it works.
Absolutely. Well, you invested a lot in this time and talent, right? So I'll make sure.
What are the risks or side effects that from this process that we could experience? I mean,
well, the risks are just like anything else. You are getting an injection into your knee. So anytime you break the skin, and you risk an injection of an infection, but it's the same risk that you have if you get your blood drawn.
Yep.
It's the same. It's no different risk than getting a shot for anything. So that is probably the biggest risk in there. The preservative that we use and how we preserve them is very hypoallergenic, but people can be allergic to anything. People can be allergic to the antiseptic that we rub on your leg. So the nurse practitioners are really good about asking about if you have any allergies, asking about if you have any sensitivities, you have a history of different things that may interfere with your care. So because, again, you're moving your blood, you're putting it from here to there. It's your own blood. It's you, right?
Yeah.
The stem cells are what they call immune privileged. They look like this. If you put them under a microscope, those stem cells and your stem cells would look the same. You wouldn't actually under a microscope be able to tell the difference in them. So your body doesn't actually attack them because they're not anything yet. They're just little cells that are there. So they don't have an immune response to that. So
okay. Yeah. So really, essentially, it's very, very low risk then. Yeah. Essentially, as long as you're following the protocol, keeping the area clean afterwards, for a couple of days or whatever it is.
Yeah.
Okay.
But I will tell you you will probably notice, Doug, is your knees are going to get sore today. When I'm not laughing, but I had this process done myself, and the one time I was like, oh my goodness, like it was just like I had kind of. I had really achy knees. Like I had achy knees for a long time anyway, so it wasn't any big difference. But I was shocked at how sensitive they were for about 3 days, and then all of a sudden they were completely like, "Oh."
Well, it's funny you bring that up because actually at the beginning of my PRP process this morning, I talked to Christine. And I'm like, I forgot the exact question or the way I worded it. I said, "Hey, it's any issue with me, being on my knees today?" That's what I said. I said, "Hey, can I be on my knees today?" She goes, "Well, as long as you're not installing hardwood floors." So I'm like, "Well, I'm doing flooring on my boat, so
yeah,
it's not necessarily hardwood floors, but I am it's just kind of weird that it kind of went to that." But she said I shouldn't really have an issue as long as I'm not on there long term, because it is a boat. I'm only getting down on my knee once in a while, carrying up and down. So, but she says if it starts to bother you, just take it easy. So it's just it depends on the person, I guess.
Right.
Right.
With the stem cells, you want to be a little bit more relaxed that first day. The PRP, your body's going to do what it wants to do. And,
okay. Yeah. All right. So can you share any patient stories that stand out? And the one I was going to bring up is, and because I kind of missed this part during your presentation at the when you were doing it at Rose's, but my wife heard it. It was about the lady that really was using a walker, couldn't walk or whatever, and she kind of went through the process. But is there any other stories, or if you want to repeat that story to everybody?
Well, there's a lot, but so you're asking me to pick one, but I will tell you, to me, the most exciting thing is when people tell me that they're doing things that they love to do again. I have a gentleman, and he's a bit younger than you, and he dropped a car on his knee, like that. Well, a car, and did a bunch of damage when he was like 16, and he always was having a lot of different knee issues, and through his whole life. And he loves to hunt. He loves to walk in the woods. He loves to just, do stuff. And he kind of started quitting all of his stuff, but he was not, he's not old. He's in his 40s. And he was just telling me how, he's got some young kids and he's like, I want to play catch with my son, but I can't. If I take too many steps in the wrong direction, like tomorrow my knee's swollen, I'm going to sit out. It's like, so he's like, it's that trade-off of being a dad. I want to do this, but I tell my kid, no, I can't do it. Right. So that's to me the amazing stories. When all of a sudden he's playing catch with this kid, then he told me he went out hunting with his two brothers. And he said, I usually I'm in the back of the pack and I'm trying to like just keep up with them. He goes, I actually was in the front, in the middle, and like nobody waited for me like to get up and down the hills because my knee was bothering me. So I had another one, and she was quite a bit older. She's kind of 80 and was thinking that there was nothing that could be done with her knees, and now she's just says, I can't, I'm sweeping my house, I'm doing everything I wanted to do, I'm going out shopping, she just like all of a sudden now is going, you'd be amazed. Like she goes, I didn't realize how much I wasn't doing because I just slowly did less and to accommodate me. Right. And then when she could do stuff, she's like, oh my gosh, I forgot I don't go to the park anymore. I haven't done any of that in years. And so it's really about quality of life. Yeah. I mean, you can say their pain is gone, but you could take an opioid and be out of pain. That's for sure. That's a disaster. Don't do that. Exactly. But it's just living life without thinking and getting up in the morning and going.
It's not necessarily to put you back into your 20s. It's more or less to get you to do the things that you just haven't been able to do.
That you want to do.
Right. That you want to do. Right.
I mean, it will feel like you take about 20 years off your knee. Most people tell me like that. But it's not going to be brand new. It's not going to be, I don't want to overhype this. That, if we x-rayed it, you wouldn't have a 20-year-old knee or a 30-year-old knee. But you don't need that at this stage. You need that because when most people just want to hit the level of activity at that age that they need to do. And that's what we're here to try and help people. Avoid surgery, number one, and live life, number two.
So one of the biggest questions, and it's the question that I had as well, is this covered by insurance? Does my insurance cover this?
Sure. The answer,
or any insurance per se.
So the answer right now is PRP is starting to be covered for things. So Medicare is covering it for like different things like wound care and different things because they know it works. So I think we're going to start to see PRP expand, and once Medicare does something and they start putting it in, it's always at the legislative. Like somebody has to put a law in somewhere, or insurance company has to. Insurance companies don't like to pay for more things. If you don't, I don't know if you know that, Doug, but they don't pay for more.
They don't like to pay for the things that they have to pay for.
So it's going to be slow coming. The other problem with the stem cell therapy is it takes usually over $100 million to get a new drug on the market. Just with as a baseline to get through the FDA. That's actually $100 million to the FDA. Not even like all the research and stuff. So there's not really the money to really pay to get all this done through personal people. It's going to have to be coming through the colleges and coming through the universities and coming through all the research facilities that are going to push this all the way through.
Well, I'm seeing that.
So the answer to your question is no. This is not. I mean,
not covered, right? And so when I started looking into this, I realized that there's a lot of other countries that are doing stem cell and PRP type therapy. And it's just not prevalent here. The fact that I found somebody that does it here in Canton, which is where I live, was fantastic for me. And that's the reason why I came here. But so why is it though these other countries are still doing this better medicine per se, if it's considered better, and that we haven't gotten to that level yet? Is it just?
I don't want to say this, but our therapy is between about 10% to maybe 20% of the cost of a knee replacement. Okay. So if you
it should be cheaper, so the insurance
should, but you look at the amount of money the hospitals and surgeons and the whole medical model makes off of replacing a knee versus doing 2 injections. Mm-hmm. they're not in the same wavelength. So there's going to be some pushback from a whole. I'm not saying that again. Not the doctors' office again.
It's a political. It's a political system.
Yeah. So that's part of it. I really would like. I know it's going to come this way, and it can't be stopped because it's so helpful. The PRP and that stuff. It already is. People are demanding it. So I think, Doug, it really has a lot to do with. Unfortunately, in the Western medicine, healing is always a pill, potion, or lotion. And if these aren't pill potions or lotions, they're not pushed. There's not a pharmacy. There's not a thing on it. These are just natural things that come. So I think that's always a slower route. I mean, if you look at chiropractic, we've been around since 1895. We always win. If you put meta studies against chiropractors against medical doctors and drugs and surgeries, we win every single time. We always have. So it's a very, as an example, if you have chiropractic covered in your insurance, the average cost of your patient care goes down by $500. Why? Because we've avoided maybe a carpal tunnel surgery, maybe avoided a back surgery, maybe avoided someone going on disability or cheaper than PT or a lot of different things. But they are still resisting that because the people in control of that are not open to the natural ways.
Yeah, and I know there's a lot of discussion. I don't really want to get into it in this one, but I mean, there's a lot of different theories out there that people are saying how medical's ran by the drug companies and all that other kind of stuff. So I know there's a lot of political type things that are involved in that. So I really don't want to touch on that because that could be a whole 2 hours.
I wouldn't mind actually showing you where you can actually see the history where the healthcare changed and who changed it. That we did I did a deep dive on that a while ago, and then I found other people have been looking into this, figured out. But the answer to this is, natural things are the way to go, and it's not just us that's doing it. It's like you said, worldwide.
No, and it seems to be more prevalent. Like I said, my wife and I, we've been looking at holistic type stuff more so than the modern medicine type deal. And that's what kind of drew me to this is I wanted to try something different. I didn't want to do the knee replacement. I wanted to try something to actually heal it and keep my own stuff. So,
and just to say one more thought on that. Do you remember, if your doctor went to school 20 years ago, he was trained in what the technology was or what the healing was 20 years ago.
Yep.
So a lot of medical doctors aren't aware that this is even an option for PRP or aren't aware of stem cell because they would have to research this on their own.
Yep.
So there's no stem cell, a person going to their office to tell them how great stem cells is. They either have to research it on their own, hear someone that did it, or, been in college or university where recently where they would have actually been hearing this stuff.
So I don't want to take up too much more of your time. So just within, maybe the next 30 seconds, where do you think this is going to be in 5 to 10 years? Do you think it's going to be more prevalent, or do you think we're going to still kind of be stagnant on it? I mean, do you see that? Are we increasing, getting better? I mean, based on listening to you over those last 30 minutes, it sounds like we're slowly getting to that level, but.
Well, I mean, that would be the example I said. A few years ago, the laws changed in Michigan, which allowed us to do more natural healing stuff in here. Mm-hmm. In general, chiropractors are the ones that are looking for the more natural routes, So as the laws have changed, as Medicare is now going to have to pay for one thing with PRP, it'll probably then pop into the next thing. And once Medicare usually starts paying for things, other insurance follow the Medicare guidelines. So we're going to start to see, at least with the PRP, in the next few years, keep expanding. The stem cells are, because it's the change the last 5 years ago, how effective they are. It's word of mouth, Doug, just like you. When you're doing great, or all my other patients are doing great, or just going and telling everyone. So all of a sudden it's going to be a natural kind of a grassroots improvement in there, because nobody wants a knee replacement. They want their knee to not hurt, to function well. And if you could not do the rehab and all the surgeries and stuff and actually have all the benefits, I mean, it'd be crazy not to do that.
But one of the things that I seen, and I was mentioning it with Christine earlier today, was on Netflix right now, there is a series out there called Quarterbacks. I'm not sure if you've seen it yet or not.
Not yet.
But the first season, they had 2 different quarterbacks. So this season, they got 2 different ones. And one of them, quarterbacks, had an Achilles type of injury. And their quick solution to get them back was stem cell and PRP. So, to me, that's what I look at. When you're looking at someone that's got the multi-million dollars,
absolutely,
and then that's what they're going to, because they need to go out and perform these sports. That's what turns around and helps me is to make the decision of, I think I'm going to give this a shot. So
that is amazing, Doug. We've known that for a long time. The pros have been doing this, and now it's coming down to just you don't have to be a pro athlete or a multi-million-dollar, because the accessibility is changing. With I'm not the only one in my area doing. I know there are other people doing it. I think every year after year we're going to see more. the applications are bigger too for stem cell. I mean, everything. I missed the window for hair restoration.
I was going to bring that up earlier too, because I'm like, oh, you can use stem cell for hair, but
You can do it, but
I'm already too old for that.
Yeah, exactly. But there's, like you said, now the access, because it's been proven time and time again. If the people have all the money to do the best things, do that. Then that's why I want my patients. And we make it affordable to get that.
So tell everybody how they can get in contact with you. What's your best way of getting, coming in? How do they find out if they're right for PRP/stem cell?
Well, the very first step, we are Vital Flow Wellness and Chiropractic. We've changed from Brackney Chiropractic because we're reorganizing to be able to do more stuff. The easiest way is just call our office and 734-455-4444. You can tell them, hey, I talked to Doug. We'll give you a free consultation. We'll sit down with you for 15 minutes and just say, hey, does this make sense? Or could you be a candidate? If we are, we could talk about next steps, taking x-rays and doing exams. But, hey, that's your questions. How can I help me? And we'll kind of take a look at that. That's the easiest way to give us a call. You can follow us online and Instagram and all the different places. We've got our website up and running. Everything is going well. So, but the easiest way is just call or text that number and just say, hey, can I get an appointment? And we'll be able to get you in. You can follow us on Facebook, all kind of things, because we will be have another need dinner. The demand is huge. People are just hurting. So we will continue to help people. Our purpose is to help as many people as I can naturally get better without drugs or surgery.
Good. All right. Well, in the meantime, you guys can continue to follow my journey. I'm only in month 2. I've had a stem cell and a PRP. So I got one more PRP, another stem cell, and then 3 more PRPs after that. Follow along and check out my journey, because I think it's going to be amazing. I have high hopes for it. And I'm hoping it's going to work. So in the meantime, thank you for taking your time to give us this interview and educating everybody that's out there watching my videos. And hopefully other people will be healthy.
Yeah, I'm honored to take care of you. And I appreciate you trying to share this with more people.
All right. Thank you, sir. Appreciate it.